Hi ladies, how you doing? I am popping in for a Facebook Live recap on yesterday's group, which was all about anxiety. So before I get started, hopefully you saw the post this morning. So I'm going to do a little bit on anxiety today, and there will be some relaxation exercises in with this video as well, which I would really like you to try. In fact, it's not really like, I want you to try them and tell me how you feel. We did them in the group and everybody was, yeah, that was great. It really worked. Okay, so like with all this stuff, you have to take action, you have to do. All right. The other thing is we have Laurie McAllister coming in to talk about her personal journey with anxiety. And also I am firming up a date with Dr. Helen Belfield, who is an amazing clinical psychologist specialising in addiction, and she will come in and do an interview with me on anxiety and share her understandings, learnings and her favourite interventions. So hopefully we will cover some different bases. I'm sure that we will revisit this from time to time, and obviously I will continue to do as much learning on this as I can. I have put feelers out. Really what I'm looking for is people coming back to me with something that I don't teach already, hence why we've gone for the big guns with Dr. Helen, because yeah, that's where I do most of my learning. That doesn't mean I can't keep learning, I definitely can. I keep seeing what's out there. Laurie will also have, I'm sure, some amazing book recommendations, and I would say if she recommends a book, it's pretty good. She knows her stuff. So let's get started. So anxiety. So we talk about our human process quite a bit in here. So thoughts impact on how we feel, impacts on our behaviour. Now, some of you you'll be more aware of your thoughts, that your thoughts are loud, and some of you will be more aware of your feelings. You are having thoughts and feelings. It's just our process and what feels more dominant to us and what we're more aware of, okay? And it doesn't mean anything, there's nothing wrong, it just is. So some of you, it will be more about the thought, and for some of you, it will be more about the feeling, okay? So on a very, very simple level, anxiety is negative future goal setting. So you are thinking about something that's going to happen in the future in a negative way, yeah? It's like worrying on steroids. Worrying never changed the outcome. And I'm sure you've noticed that what you're thinking about doesn't actually happen. So, and there's different levels of anxiety, all right? I'm not minimizing this, and I'll come on to this a bit in a minute. But, you know, there's like mild anxiety and okay anxiety, and then there's serious, hardcore, debilitating anxiety where people struggle to sleep and it seriously impacts on their mental health and their life, okay? So there's lots and lots of different ways that anxiety feels and appears to us and impacts on our life, okay? But most of your anxious thoughts are not helpful and they're not fact, yeah? Common theme there when we talk about thoughts and our internal dialogue, it's that stream of consciousness, most of which is not helpful and is not fact, all right? I know you probably all know that, but I need to say that. Now, there are other components to anxiety that I want you to be aware of before we get into it. Sometimes anxiety can be hormonal. Now, that can be particularly the case around perimenopause, menopause and after menopause. If you think that is the case, please go and see your female health specialist at your doctor's surgery and talk through your options. Also, if that doesn't work for you, that sort of medical route, there are herbal options for managing anxiety during menopause and also for hormones. So don't think just because the medical stuff doesn't work for you that you can't find something. Personally, myself, I have struggled with anxiety as part of perimenopause, and the medical options didn't work for me, and I have sourced my own herbal options which have really worked, and I have a book that I can recommend if anybody's interested. Just let me know and I will post the link. But it talks about the more sort of holistic and herbal remedies that might work. Now, sometimes there is also a chemical component to this. So what I mean by that is there isn't an underlying cause to your anxiety. So it's not hormonal. There isn't a life event, you know, that's triggered or started the anxiety. It doesn't matter if the life event isn't happening now. Sometimes there is a chemical component to it. It's very much a feeling in the body, okay? Now, when this is the case, like with a hormonal, medication can be really useful. And actually, if your anxiety is impacting on your life, medication is useful, all right? I don't ever want people to feel like they can't ask for medication. You absolutely can, and it can really, really help. I'll give you an example of how it helps. So sometimes what happens with anxiety is we get caught in a loop. We get caught in being really good at anxiety, and our body gets into that fight or flight stuff and the cortisol, and it just becomes a habit. Sounds ridiculous, but it's exactly what it happens. So when medication can come in, is it can just give you a little bit of a break from that. You can put some good stuff in and it can really help you, yeah, as a temporary measure. So don't ever be worried about talking to your GP about different medication options to manage anxiety. And also sometimes you can get medication that you can take as and when. So if you're somebody that suffers not with anxiety all the time, but occasionally, but when you do occasionally it's really difficult and it feels really debilitating, then there are also medications that you can take in an emergency, okay? Also, the other thing that happens sometimes is when people have experienced trauma in their life, that anxiety is a byproduct of that trauma, and you may not be making that connection, and it can be useful to go and do a piece of work on the trauma. And that's why I posted a link about EMDR. EMDR is my preferred option for trauma therapy for anyone. My clinical supervisor recommends it, and also it's based on the feedback I get from lots of people that have experienced trauma, and they actually like that as a modality and it works, okay? Oh, it's a little bit about anxiety there. So we can get caught up in our head with our thoughts, and we can also be experiencing strong anxious feelings. So we can do both, or, you know, switch between the two, or one or the other's more dominant. We can do the work around our thoughts. So in the Kajabi app, in the accountability section, there is a video called Internal Dialogue. Please watch that if you struggle with thoughts. There will be some tips in there that are really going to help you, okay? On a really, really simple level, you know, it's not fusing with your thoughts. It's learning how to be an observer, to let them pass, to not connect with them, to not wallow in them, all right? But please go and watch that video. If you don't know where it is, ask me. I will talk you through it. So I'm a big fan of us doing the work with the thoughts and the talking therapies, but I'm also a massive fan of us doing the work in terms of feeling in our body. So you'll hear me talk about lots of different things, and you'll hear me talk about action a lot. You'll hear me talk about exercise and yoga and doing and dance and hobbies, and you know, there's a lot of reason for that. Distraction obviously is part of the work that we do here, but it's also good to get our bodies moving. You know, sometimes we carry these feelings in our body, we get our bodies moving, we can move that about, it can release some of it and it can feel good. So it's nice to tackle it in different ways. Yoga is really good for anxiety. Exercise is really good for anxiety because it's the action, you know, when we have that feeling in our body, then we can learn how to release that in our body, okay? So one of the things I talked about is acceptance and letting go. Now, sometimes, not all the time, sometimes what can happen in life is we experience feelings of anxiety or stress or frustration or whatever it is about a situation that we are not in control of, yeah? And we can get caught up in these feelings because we can't change it, and we get stuck in these feelings, okay? So when I talk about acceptance, I'm talking about accepting life as it is, okay? You'll hear me talk about acceptance and letting go a lot in the context of many, many things, okay? So it's about experiencing a situation as it is, rather than imposing your will on it, wanting to change it, wanting to control it, okay? So a willingness to accept things as they are, not how we want things to be. It's not good or bad, it just is. You're not allowing it to go on forever by accepting it, and you're not giving up on your options by accepting it either. So what I mean by that is, sometimes that can feel really difficult, particularly if it's a difficult situation. So I'll give you an example. So when I was quite a way into being drug and alcohol free, I was really struggling with my ex-husband's behaviour, and in turn my son's behaviour as well. It was really, really difficult. It'd been difficult for a long time, and I was in anxiety and fear quite a lot of the time. And there was nothing I could do about this. I was doing everything I could about the situation, but I couldn't change the situation short of moving away and changing my name. I wasn't going to do that. 2 different children, 2 different fathers, lots of family, lots of friends. You know, it was dangerous, but not, you know, it was a balancing act. Yeah, I was making a decision to suit all of us. And I can remember my therapist at the time saying to me about accepting the situation as it was, not fighting it. Yeah, so I was in anxiety and fear, which wasn't helping Elliot at all. So it sounded quite radical to me to accept. Why would I accept this? This is horrible. It's not my fault. It shouldn't be happening to me. It's not fair, blah, 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 blah. But it was. And nothing I did or said was going to change that. And it was really interesting when I started playing around with that concept of acceptance. Accepting my life as it was, accepting my situation as it was, accepting Elliot and loving him as he was. I'm not saying I didn't love him. Of course I did love him. But, you know, if you have a child with challenging behaviour, you know, acceptance is definitely part of the journey, and working with what you've got. In the same way as if you've got a partner that has issues, you know, acceptance plays a part in that as well. So how I learned how to accept and then let go, it really helped me to let go of that anxiety and fear and just be with the situation. And actually things started to turn around after that. I'm not saying that the acceptance and letting go is the thing that made the difference, but it definitely helped. So, and another way of describing this, so Dr. Helen might describe this as well. So for any of you that do yoga or Pilates or any type of sport, weight training, anything like that, you might, dancing, ballet, you might be in a position, you know, where it feels quite strong and quite horrible and quite tight. You know, like yoga, if you do the warrior pose, everything's shaking, it hurts. How are you holding it? You know, that type of stuff. When actually the yoga teacher says to you, just let go and accept and sink into the pose. It's the same type of thing. Stop fighting, stop hanging on. You know, what can you, I know this isn't relevant for everybody depending on your situation, but how can you accept, you know, and sort of drop into that so you let go of the anxiety, okay? So I just wanted to bring that to the table because I love talking about acceptance and letting go, because I think it's massive and I think it's a huge part of life. And when we accept ourselves and our lives, then we can let go and we can move on, and it frees us up rather than fighting about it. Okay, so let's talk about some coping tools for anxiety. So we did a safe space visualization, which I'm going to do. We talked about mindfulness. I'm going to talk a little bit about that. But before we do that, I want to talk about distraction. So we talk about distraction a lot in terms of managing our cravings and our feelings, you know, in the first few months of making changes to our drinking. Do not underestimate the importance of having a handful of things that you can do to distract. And this is the same with anxiety. Now, action is a huge part of this again. So remember I talked about the feeling being in your body. So movement, yoga, music, dance, or, you know, if it's getting out of your head, activities, art, crafts, readings, you know, what's your process and what do you need to do? Do you need to get out of your head or do you need to move your body? You know, is the feeling in your body? Yeah. So have a list of distraction activities that are going to work for you, depending on what your dominant process is. Is it in your head or is it in your body? Okay. And we talked about a number of different relaxation techniques. Now, it's important for us to learn how to relax for so many reasons. Again, it's something we talk about as part of being alcohol free or reducing our drinking. So many people talk about using alcohol to relax. And when we take that away, we need to learn how to do it for ourselves. But it's way more important than that. So learning how to relax has a lot of benefits for us. So practicing relaxation techniques are really going to help. So I'm going to share some relaxation techniques. And what we did in the group is the ladies said they committed to doing one as a daily practice for the week so they could notice the difference, yeah? And some of these take like 30 seconds, not even that. So I don't care how busy you are. You can sit at your desk at work and take some deep breaths. You can do the safe space visualization. You can do the color breathing. You can do the mindfulness when you're washing up, when you're walking. There is no excuse. I want you to do this, okay? Practicing and learning how to relax reduces your tiredness. It improves performance. It reduces pain. So if you think about anxiety and stress, we can be in tension quite a lot. Coping with stress, it improves our sleep. Obvious, again, anxiety and stress are quite heightened states, so it's hard to come down off that. So obviously learning how to relax is going to improve our sleep, improves our self-confidence and relationships. There's lots of wins involved in this. So I want you to remember that when we feel anxious or stressed, our breathing rate increases, as does our blood pressure, our heart rate, our muscle tension. Sometimes we sweat, but it increases our mental arousal and our adrenaline. So learning how to relax helps us to decrease these things. So imagine if you're anxious and stressed a lot of the time, you're functioning at these higher levels, and that's where the habit comes in, the cortisol, the adrenaline. That's where we get stuck in those loops. That's where people get stuck in using alcohol to come down, when actually what we need to do is just practice some relaxation techniques, whether we're feeling like this or not. So that's the other thing. It's just having it as a daily practice, not necessarily using it in a crisis, yeah? You don't have to just use it in a crisis, okay? In fact, I want you to do it as a daily practice, okay? It's rare that I tell you to do anything. I'm telling you to do this, all right? So we talked about breathing deeply, okay? Now, I would like you at different points throughout the day to notice your breathing. My experience is a lot of people are very shallow in their breath. I do it as well. I have to remind myself to breathe deeply, yeah? So a really simple way of doing this is to breathe in for 5, is to hold for 5, and to breathe out for 5, and to do this a few times, yeah? So let's do it now. Breathe in for 5, hold for 5, and breathe out for 5. And when you breathe out, I want you to really let go and breathe out. So let's do that a few times. Breathe in for 5, hold for 5, and breathe out for 5. Now, I want you to take this a little bit of a step further, and I want you to do a little bit of a body scan, yeah? So this can be a really good thing to do. So I want you to sort of, while you're breathing deeply, I want you to just check, at your face. Do you need to relax your jaw? Is there any tension in your neck? Can you just let that go? Tension in your shoulders, in your arms, your hands, can you shake it out? Is your stomach tense? Are your buttocks clenched? Your leg muscles, can you just release them? Your toes, have you got them scrunched up? Just do a little bit of a body scan and just let go of the tension in your muscles while you take some deep breaths, yeah? So that's something that you can do on the train. You can do deep breaths while you're walking. You can do this while you're sat at your desk at work, yeah? You can do it in bed. so it doesn't have to take up too much time. In fact, I recommend that you get into the habit of, at different points throughout your day, just taking some deep breaths. I do it when I'm walking quite a lot. I do it when I'm running. You know, I really concentrate on my breath. I'm not very good at it, and actually Tam and I had a bit of a conversation about that last night. You don't have to be really good at breathing. It's just doing your best in terms of deep breathing and letting go. Okay, so let's do the safe space visualization. So it starts the same way, with some nice deep breaths, same as we've been doing. Breathe in for 5, hold for 5, and breathe out, and just keep taking those deep breaths. Okay, and I want you to do the body scan as well. Make sure that you're sitting or lying down somewhere comfortable. Okay, and just do that body scan. You know, check your muscles in your face, your jaw, your neck, your shoulders, your arms, your hands, buttocks, legs, your feet. You know, let go of any tension, anything that you're hanging onto in your muscles. Okay, and what I want you to do is visualize a place where you feel calm and safe. So take a moment to imagine and bring that picture up and see it through your own eyes, and see all the colours, lovely, bright, beautiful colours. Make it nice and big and nice and bright in your calm, safe place. Now, are there any sounds that you can notice? There might be, there might not be. Are there any smells? Now, are there any skin sensations? Can you feel the earth beneath you? What's the temperature on your skin, in the air? Are you moving? Can you feel the movement? How does the air feel? Are you touching anything? So just take a moment to really enjoy that safe space visualization. You've just taken some deep breaths, you've done a body scan, you've let go of the tension in your muscles, you've visualized a place where you feel calm and safe, you've made the picture nice and big and bright. See if there are any sounds, any smells, any skin sensations, the earth beneath you, temperature, movement, air. Okay, so that's the safe space visualization. Really quick, really easy. For some of you that will have worked. If it works, use it. Also, we talked a little bit about mindfulness. So mindfulness is a new word for an age-old spiritual practice. There's nothing new about it. It's been something that's been taught since the beginning of time. Essentially, it's paying attention in a particular way, on purpose, in the present moment, with no judgment. So you can practice this when you are doing a normal daily activity. So it could be when you're washing up, when you're eating some food, when you're walking. It's particularly lovely to do when you're walking. And you just take yourself through a set of questions. So what can you see? What can you hear? How does it feel? Are there any smells? What can you taste? And the idea when you do that is that you focus outside of you. So remember, if you're somebody that gets caught up in here, that if you take time to focus outside of you, that feels nice, even for a moment. And it's something that you can do at any time, you know, and it just brings you into the present and helps you. It's good for focus, it's good for lots of things really. Okay, Then the other one we did was colour breathing. So again, I would like you to focus on your breath and take some deep breaths. So breathe in through the nose, hold for 5, breathe out through the mouth. And what I want you to do while you're taking deep breaths is to do that body scan and let go of any tension. So tension in your face, in your neck, in your shoulders, in your arms, your hands, your fingers. You sink into where you're sitting so that you're really comfortable. Let go of the muscles in your bum, your legs, your feet. So you're just letting go of the tension and you're focusing on letting go, breathing deeply and being comfortable. Yeah. Now what I want you to do is choose a colour that for you feels calming and peaceful. And I want you to imagine that colour is surrounding you as a mist. And as you continue to breathe in deeply, I want you to breathe in that colour. So nice deep breaths, breathe in and breathe out. And when you breathe in, you're breathing in the colour. And when you breathe in the colour, I want you to breathe it in so the colour goes up your head and your shoulders and down your arms and your body, your pelvis, your legs and your feet. So as you keep breathing deeply, you breathe that colour in throughout the whole of your body. Take a moment to really enjoy and notice how calm and peaceful this feels. So what I would like you to do is pick a relaxation technique, and I would like you, or you can do a different one each day, I don't mind, but I would like you to do one each day, please. I would like you to integrate as part of your day a moment for you where you learn how to relax, where you let go of tension, where you breathe deeply, where you pay attention and lower those heightened systems, and just notice the difference, and let's see what results you get from that. Okay? Any questions, please ask.